All right, so let's go over dexmedetomidine or precedex. There are a couple of key points that you need to know for your anesthesia exam. So let's just go right through it. So the first thing you want to know is the mechanism of action. Precedex, aka dexmedetomidine, is an alpha 2 agonist. Remember this. Sometimes exams will ask you what the mechanism of action is, and they'll try to trip you up by saying that it's an alpha 2 antagonist, but that's incorrect. Precedex is an alpha 2 agonist. And then the other key point you want to know is that precedex has a certain selectivity. Though it works on both alpha 2 and alpha 1, it is much more selective for alpha 2. So the selectivity is 1600 to 1 in terms of alpha 2 receptor selectivity. And then some questions will ask you which is more selective for the alpha 2 receptor, whether it's precedex or clonidine. And the answer is precedex. Precedex is much more sensitive for the alpha 2 receptor compared to clonidine. Next, they will ask you about sites of action depending on the type of effect that the medication has produced. So there's three main sites of action that you want to remember. The first one is for sedation. It occurs because the medication acts on the locus coeruleus. This also can lead to hypotension and bradycardia. This is a key side effect from prosthetics, that is bradycardia. And sometimes that bradycardia can be so severe that it can lead to asystole. The second site of action for analgesia is done at the dorsal horn of the spinal column. And the third thing that sometimes questions will ask you is if the patient, instead of getting hypotension, instead gets transient hypertension, where does that occur? Well, that occurs at peripheral blood vessels. Now, you may be wondering how is it able to create both hypotension and hypertension? Well, the medication has a biphasic response. That means that first there will be hypertension due to the bolus, and then later on it will lead to hypotension. So a bolus of Precedex will typically cause transient hypotension that eventually leads into hypotension, but a continuous infusion will almost always cause hypotension. So just remember that bolus leads to hypertension, infusions will cause hypotension. Now, a difference between propofol and Precedex is that Precedex will preserve airway reflexes and patients are much more arousable, unlike propofol, where patients will be unable to protect their airway. So Precedex is great for cases where you want minimal sedation, but you want the patient to be comfortable. Now, like propofol, Precedex will affect CMRO2 or the utilization of oxygen in the brain. Cerebral blood flow will also be decreased and MAC requirements will be decreased. So whether you give propofol or Precedex, you'll pretty much require less sevoflurane during your case because your MAC requirements have diminished. Now, side effects and just a couple of things to remember about Precedex. So again, bradycardia is one of the main side effects from Precedex, and it could be so severe that it leads to heart block or asystole. And then the other thing you want to remember is metabolism. So Precedex is metabolized by the liver. This means that patients with hepatic dysfunction will require less dosage of Precedex. If you give a standard dose of Precedex to a patient with hepatic dysfunction, that medication will linger for a longer time, and the sedative properties of Precedex will last for a longer time. So that's pretty much all the basic, a lot of the questions that you'll see regarding prosthetics. Now let's go through some practice questions just to cement the ideas that we talked about. So the first question is, prosthetics exerts its effect through which receptor activity? And here are your answer choices. There's alpha-2 antagonism, alpha-2 agonism, alpha-1 antagonism, and alpha-1 agonism. And the answer for this is alpha-2 agonism. Remember, it's agonism and not antagonism. Next, let's go to a second practice question. So Precedex achieves analgesia by acting on which site? Is it the dorsal columns, the locus coeruleus, or peripheral vasculature? And the answer is dorsal columns. Dorsal columns is what allows for analgesia from Precedex. Locus coeruleus will lead to sedation as well as initial hypotension. And peripheral vasculature is where you will have transient hypertension. So just remember that. The third question is, what is the primary mechanism by which precedex causes hypotension? So we just talked about that. The three answer choices is by decreasing pain, by decreasing norepinephrine reliefs, or by acting on peripheral vasculature, leading to vasodilation. The answer, this one might be a little tricky, but it's actually B, by decreasing norepinephrine release at the locus coeruleus. So the mechanism of action for how precedex leads to low blood pressure is that precedex will actually decrease the levels or the amount of norepinephrine that is released at the locus coeruleus, and this decrease in norepinephrine leads to hypotension. Hypotension. Now, choice C might be tempting, but this is incorrect. It does not lead to vasodilation. Acting on peripheral vasculature by precedex actually leads to hypertension. So remember that. Hypotension is the locus coeruleus. Hypertension is done at the peripheral vasculature. Now, this is the last question, a little bit longer than the other ones, but let's go right through it. So this is a 74-year-old patient with a history of chronic kidney disease coming in for left wrist surgery. A block is to be performed. The patient is extremely anxious prior to the block and has a documented reaction of anaphylaxis to Versed. Versed is also midazolam. So the anesthesia resident wants to administer precedex to this patient prior to the block, most likely for a little bit of anxiolysis, a little bit of sedation prior to the block. What is the likely response from the anesthesia attending to hearing that the resident wants to provide precedex? So these are the four answer choices. Option letter A is no, because the precedex will have decreased metabolism in this patient, leading to longer lasting effects of the precedex. B is yes, precedex is fine prior to administering a block. C, yes, precedex is fine, however, it will cause tachycardia in this patient. And D is no, precedex should not be used as it will lead to higher MAC requirements. So let's go through the incorrect answers. So option A is incorrect um, because it says that metabolism would be decreased in this patient. This is incorrect. Metabolism is decreased in patients with liver dysfunction. This patient, on the other hand, has chronic kidney disease. In chronic kidney disease, Precedex is perfectly fine to use. Liver dysfunction is where you want to be a little bit more careful. The next answer choice that is incorrect is C. Yes, Precedex is fine. This part is correct. However, the tachycardia portion is incorrect. Precedex does not cause tachycardia. It actually causes bradycardia. And sometimes that bradycardia can be so severe that it could lead to asystole. And then D is also incorrect. No, Precedex should not be used as it will lead to higher MAC requirements. That is false. Precedex leads to decreased MAC requirements, just like propofol. So you don't need as much sevoflurane for maintenance. That leaves us with B. Yes, Precedex is fine prior to administering a block, especially in this patient. Precedex is great for a little bit of sedation. So yeah, the anesthesia resident in this case was correct. You can give Precedex for this block. And so with that, that pretty much covers everything you need to know about Precedex when it comes to your anesthesia exams.